About 400 million people worldwide are living with type 2 diabetes mellitus. This disease, characterized by insufficient blood glucose regulation, severely reduces the quality of life of patients and their families and leads to about 1.5 million deaths each year. Unfortunately, against our best efforts, both the number of cases and the prevalence of diabetes has been steadily increasing over the past few decades. This epidemic of diabetes has not yet been halted, in part due to a lack of tools that allow the early detection of the disease. Even though continuous glucose monitoring devices such as this one can now generate rich, frequently sampled time series of glucose data, the impact of CGM on diabetes prevention and care has been lacking, primarily because the existing analytical methods to quantify the patterns in CGM data are inadequate. The currently used simple summary measures, such as the mean glucose throughout the day, discard the temporal dependence, in other words, the shape information in the data, and therefore misses the nuanced but critical shifts from health to disease, as seen here in the change from sample A to sample B. In this project, we aim to develop novel techniques based on artificial intelligence that will exploit the temporal dependency in CGM data instead of discarding it, in order to better quantify the changes in metabolic health. In this way, the model-derived latent representation allows a more sensitive and more precise measure of glucose regulation, making the nuanced shift from health to disease detectable and quantifiable, and therefore contributing to an improved diabetes prevention and care.